My name is Phoebe Ongadi, the Executive Director of Kenya Network of Cancer Organizations, also known as KENCO. KENCO, we are the national umbrella body now for about 80 cancer-based civil society organizations. What we do is that we coordinate the efforts of these organizations and promote cancer advocacy, patient awareness, patient support, and just to ease the burden of cancer in the country. So KENCO has been around now for 10 years, though I joined KENCO, this is my third year as the Executive Director, but the organization has been around for 10 years. So it has been 10 years of advocacy, 10 years of empowerment, 10 years of patient support, just to lessen the burden of cancer and to ensure that patients who have cancer live quality life through access to medication, support services across the care continuum of cancer. So that is who we are. We are based in Nairobi but spread all over the country. We are also known as the Cancer Patients Grassroots Organizations. Apart from bringing, one of our biggest achievements, apart from bringing together all these cancer-based civil society organizations to have them talk in one voice and to have them coordinate efforts of cancer control, and apart from empowering them with capacity building and ensuring that they are well advocates of cancer, we are proud of the advocacy efforts that KENCO has done. And top of the list is the operationalization of the National Cancer Institute that was advocated for by KENCO, among others. That is a semi-autonomous government agency that is part of the government that is just concerned with strengthening cancer efforts and control, known as the National Cancer Institute of Kenya. That is one of them. Another one that we can look for back over the years is the cancer health financing, and we started that a long time with the National Health Insurance Fund. When we expanded, we pushed for expansion of that fund to have oncology package, and actually the oncology package that we had under the National Health Insurance Fund, also known as NHIF, has been one of the best. And we did not stop there. When the Social Health Insurance Fund came up, and then when we were looking at it 1 year down the line, we told the government that we needed expansion of that because whatever was being offered for patients at that time was too little. And out of our efforts, the government, through the President and the National Assembly, they were able to revise it from 500,000 Kenya shillings now to 800,000 Kenya shillings. Even though that is still not enough, we feel that it is better than what the patient had before. So basically, those are the main issues. But apart from the advocacy and also the support for member organizations, there is also the patient-based support empowerment. We have distributed over 75,000 rehabilitative materials to patients. These are materials that support patients in their care journey. The breast prosthesis for patients who have to lose a breast because of breast surgery, and also the prosthesis bra that have to support that synthetic breast, the hand sleeves, and many others across the country. We are also distributors of the cancer education materials for patients and caregivers, also known as CMPC, and we partner with the major cancer centers in the country, and we have done over 100,000 booklets. These booklets have been very helpful to demystify cancer diagnosis for the health worker, for the patient, and also for the caregivers. And finally, we have done empowerment for the civil society organizations for cancer. Over 5,000 people have been trained over the years on advocacy, on simple awareness, risk factors, to promote awareness and to demand to increase the demand for cancer early screening and diagnosis. The burden of cancer is remaining so high mainly because of two top things: the delay in diagnosis and then lack of awareness. So the moment people do not know awareness of those early signs, awareness of where they should go, then that affects a huge chunk. And the way you have rightfully put it, cancer is one of the leading causes of death in this country. But unfortunately, 75% of cancers are being diagnosed late. And when a cancers are diagnosed late, then the prognosis is poorer. So it means lesser chances of survival. So then how do we reverse this situation to ensure that cancer is diagnosed early? Is promoting awareness. So delaying diagnosis has been a challenge for us. Another challenge that we have had is the issues around healthcare financing that causes that disparities. People in the rural areas, for example, are not able to pay for diagnosis, they're not able to pay for screening, they're not able to pay for treatment. And even under the Social Health Insurance Fund and even other insurances, we see patients are still being told to pay out of pocket. And then another huge issue is on access. Access is a real challenge right all the way on the cancer care continuum. Access to diagnosis. For example, if we do an awareness in a certain community and we tell them these are the early signs and then these are the screenings, maybe we do screening for cervical cancer, for example, there needs to be that closure that after the screening, then this patient should be able to receive the care that they need. There should be that linkage. So those are the reasons why we are diagnosing cancer late, and the reasons why cancer is still the top, because patients are not able to pay for it. There is a lot of delay in diagnosis, and then the access of those diagnostics and treatment is still not imparable. It is it varies from one region or even on socioeconomic capability. And actually with cancer, even with socioeconomic stability, once cancer hits at a late stage, then it will definitely impoverish. First of all, what we do for access for medicine for care is we look at the finances, because medicines are bought, somebody buys them, somebody pays for them. So we have been advocating for healthcare financing so that the patients do not have to get out or in their pocket. And actually that is one of the reasons why many patients are dying, because they pay until now it becomes psychologically unstable for them. Out of our advocacy, we also partner with pharmaceuticals. We have partnered with Roche. For example, they gave us Herceptin, and that was able, patients were able to access it. We partner also with the Max Foundation. They gave us access for advanced breast cancer treatment, and we are seeing that happening. So we advocate for access of cancer care and treatment. We advocate for better policies that are that will help ensure patients have the services that they need. We are currently also very active with the policy on cervical cancer vaccination, the single dose, because we know when we capture these girls at 9 to 14 years old, for example, we ensure that their future is safe. We capture them for the vaccination at that age, and it is just one dose, and we ensure that they will protect them from one of the cancers that is currently causing the leading deaths in this country, called cervical cancer. You're very right. The cancer burden in Kenya is on the woman. If you look at the two leading causes of death and the two leading morbidity, breast cancer is the highest in cases being diagnosed, and cervical cancer is the highest of cases of mortalities. And it's only women who have the cervix. And then the breast cancer, as much as there are men, it is mostly on the woman. So these two cancers, again, we talked about delay. So then if we put up and revamp awareness efforts so that these women know those early signs, they know where to go, they know what to check for their breast, they know what to do, the screening available, the routine checkups. If we do that, then they are able to know where to get services from. And then what we are also seeing working is the lived experience advocacy, where we are having women also who have gone through cancer coming out to talk to other women through media channels like this one and telling them, for me, these were my earliest signs. So it's called lived experience advocacy. It also works for them. And then also through that, we are also going to push for policies that are better supporting. So these women, through patient navigation, through awareness, and then let that awareness be linked to care. So there is one position of telling me about cancer, about the early signs, about diagnosis, but then there is linking me to where I can get those biopsies done, where I can get the screening done. And then once it is done, linking me to where I can get the treatment. So then they should happen systematically, because the delay is what makes the tumors develop to make it late diagnosis, and cancer cannot wait. Thank you so much. On the 27th of this month, that is March, from 6 p.m, all roads will be leading to the Boma Hotel in South Sea, affiliated to Kenya Red Cross. KENCO will be turning 10 years. Add 10 years of coordinated cancer civil society advocacy, 10 years of patient support and empowerment, 10 years of just reminding everyone that survivorship is possible, and supporting survivorship is supporting families. So we are running for a cause to celebrate those 10 years and to remember those who have worked with us in the journey. We'll be celebrating different individuals in the cancer space who have made significant efforts right across the healthcare, to the pharmaceuticals, to individuals, to corporates, to hospitals and all that. So we are calling on the public to help us ensure that the next decade is secure, to ensure that patients are supported, that there is coordinated efforts of cancer advocacy, and that is why we are advocating for people to register early. Corporate tables, come in a group and take a table, come in hospitals, come in corporates, the business community, individuals, schools, colleges, and just say that we are here to support patient empowerment, we are here to support patient support, and we are here to ensure that the voices like KENCO, they endure the test of time. Cancer remains one of the pressing health challenges and health burdens of our time. And the statistics are showing us that the numbers could highly likely go higher in the near future. So then, as KENCO marks 10 years of progressive advocacy and 10 years of coordinated efforts, we are reminded that it needs a teamwork for us to handle the issues of the rising cancer burden. And one of the teamwork, it involves everyone from the community to the healthcare sectors, to the government, to the civil society, to the families, to the societies, and ensure that we push for early prevention, early treatment and diagnosis. Because when we let cancer spread, when we are still diagnosing over 75% of the cases, it means that survival rates are lesser. It means that when there is still stigma in most areas of the country, for example, it means that the uptake of these screening services will be lower. So my parting shot is that it takes all of us. It takes you, it takes me to lessen the cancer burden. And to the government and the country, we are saying it is high time you declared cancer as a national disaster.